Late-term miscarriage. Late-term recurrent miscarriage refers to pregnancies that occur between 3 months and 28 weeks, with a miscarriage occurring after the amniotic sac ruptures and the fetus protrudes during the 5th month. We refer to this phenomenon as late-term recurrent miscarriage. The main causes of this condition include 4 factors. 1. Congenital cervical insufficiency and cervical incompetence due to poor cervical development. 2. Cervical incompetence following cervical cerclage surgery, as cervical diseases can lead to cervical shortening and weakening after the procedure. 3. Congenital cervical developmental abnormalities resulting in a shorter cervix than normal, lacking a lower uterine segment. 4. Postnatal cervical damage due to tearing during childbirth. Among these causes, cervical incompetence due to congenital developmental abnormalities is the most common. Diagnosis is usually straightforward, with imaging or cervical dilation tests confirming the condition. However, often multiple factors coexist, including cervical incompetence, uterine septum, unicornuate uterus, residual horn uterus, and various uterine deformities. Therefore, comprehensive diagnosis is crucial before proceeding with treatment. Treatment options vary depending on the underlying cause. The foundational treatment for cervical incompetence is cervical cerclage, which involves placing a suture around the cervix before or during early pregnancy to prevent further dilation. This is especially important because as the embryo grows during pregnancy, cervical incompetence can lead to cervical dilation. Thus, early cerclage placement is crucial. Cervical cerclage is the basic surgical procedure. If there is a uterine septum, septum resection is also performed. Other deformities may require correction as well. Treatment is provided for a bicornuate uterus if present. Treatment for an immature uterus is also administered as needed. If there are no such underlying causes, the foundational treatment is sufficient. The cervical cerclage procedure at Antai Hospital is also known as the Antai ring or Antai cervical cerclage. Once placed, it virtually guarantees prevention of recurrent miscarriages. Our treatment policy is the same as for early recurrent miscarriages. Once the diagnosis is confirmed and treatment is provided, if the patient experiences another miscarriage during a subsequent pregnancy, we refund the entire fee. We follow a policy of signing the contract before treatment, ensuring patient protection. Some patients contact us when their cervix is already dilated. In such cases, we can perform emergency or rescue cervical cerclage surgery. However, treatment cannot be pre-contracted at this point because it is a critical and dangerous situation. Our surgery in these cases provides the fetus with a chance of survival when it has already protruded into the vaginal canal or is about to be expelled. Without surgery, there is a 100% chance of miscarriage, but with surgery, there is still a chance. The success rate in these situations cannot be guaranteed, and it provides 2 possibilities for pregnant women, one of success and one of failure. Therefore, it offers a chance for the baby to survive. Antai Hospital's treatment policy is quite accommodating. If the surgery is unsuccessful, you can choose to undergo treatment again, but there will be no refund because these are emergency and rescue cervical cerclage procedures.